Dr. Magdy is a regional expert on reproductive health and the former director of the UNFPA in Egypt. He has over 30 years of international and local expertise in designing population programs. Thank you, Doctor. Please, kindly, you have 10 minutes. First of all, I'm really thankful, and the issue at hand is really monumental, and it requires every effort. The presentation is really massive, and it covered different aspects, so it's really hard within 10 minutes to cover all of the aspects. However, based on the document that I received, the presentation that was just given, I managed to write down a list of points to address. I would like to salute the researcher, but the point of coordinations between the donors, I have to understand that the analysis of the status quo pointed out that there was a political will, there was availability of resources and decentralization of implementation and the follow-up and coordination between the different players, and also an institutional framework that is different. But now we have a momentum from the donors that would like to help the government address this issue. How can we ensure coordinations optimal or the coordination to prevent any overlap and missed opportunities? When we look at the programs provided by the donors, you can assign the different activities, but the master plan that should be adopted is the government's, while the donors help with the implementation. The other point, there was lack of information on family planning from the hospitals. There was a very quick mention of the large number of hospitals, the public and the university hospitals and the armed forces hospitals. And each and every one of them have a family planning clinic, but since the last DHS, there is no position paper that specifies the staff in each clinic, so that we can help with the distribution of staffing or the postpartum awareness efforts, because we said that we want to promote the family planning services after the birth and also expansion of the use of long-term contraceptives. Dr. Sahar graciously provided a very lengthy explanation of the unmet demand, but women are reluctant to use the contraceptives. And also, based on the DHS last one in 2014, the study commissioned by the International Population Council translated that 2.8 million women in Egypt would like to say that they would like to plan the families. However, in reality, they do not use any family planning methods. We would like to learn more about these women. The documents I have from the Ministry of Health allow me to know how many new women are starting to use these contraceptives and why they use these contraceptives, so we can identify which is the trend, the long-term contraceptives or the commonly used contraceptives, which is the pill. But the problem with the pill is that they are responsible for many unexpected pregnancies. And some brands of this pill actually stipulate that the pill should be taken at the same time, at the same hour every day. So, if all these things are mapped out, we will find high rates of use. The turning point from these pills and contraceptives to the long-term ones could be easily expected. You find that most physicians do not have the right expertise to insert the IUD, and that's why they promote the other alternatives, such as the pill. We should make sure that all the family planning service providers are well trained, and we should make sure that these trainings are up to the standards of the World Health Organization. And the family planning doctors are not only those working in the public sector, they also work in the private sector. And so if the Ministry of Health is providing these trainings, they should include the private sector. This could be the role of the donors. They can track the coverage rate of these trainings so that the rest could be given or secured by the donors. The availability of nurses. We have been engulfed in this controversy for this long. We can have health workers who help with women who are reluctant to use to be served by men. If we can have a trained and a licensed nurses that go door to door and provide the service, that would be great. So we can have trained nurses with certain qualifications that bridge the gap of the lack of doctors in some remote areas. When it comes to the cycle of contraceptives, Dr. Sahar already answered the question elaborately, but in the UNFPA in 2010 we had an assessment by international experts on the whole system of procurement, storage, distribution. And these experts put forth a number of recommendations. The one that comes to mind quite frequently is the budget that is allocated to family planning services is up until now, and you can correct me, Dr. Sahar, is it specified in the state budget? And every year it is being revisited based on forecasting and based on the population growth rates. Secondly, the way of procurement, which was mentioned by the researcher, it is being procured in different installments. If I'm doing my assessment at the beginning of the year, I'm getting my procurement at the end of the year. I mean, we are doubling or even tripling the efforts. And if we have the same companies that provide the same services, they would monopolize the market. And I know that there is a technical committee for the contraceptives, and at some point I had the honor of being on this committee, but the decisions taking should be enforced. They said that the private sector has a problem with the procurement, pricing, and the customs, and the taxation. Contraceptives is a very strategic commodity, and it should be processed differently when it comes to registration. It should be at least tax exempt. So these all are going to have a huge bearing on the point of availability of contraceptives. Private sector, it has a very pivotal role. It provides 40% of the services, so it's almost on par with the state. So we cannot set the priority to the state or to the private sector. We should work on providing the safe, affordable contraceptives in a timely manner. But up until now, we have no control over the private sector, and this is a problem that we have been so vocal about, but to no avail. And this issue is not going to be handled in one conference and one speech. It is a policy. It's a state policy. The private sector and the public sectors are partners, and they work under one umbrella. So if I have a problem with the availability of the contraceptives, there is a department in the family, in the health ministry that I can address, but when it comes to the private sector, I have no one to address. So we need a regulator. We need a regulator on the cycle and the movement of these contraceptives. So I think I overstepped my time. I'm not going to talk about the media. It has been repeated quite often. And I would like to thank the moderator for giving me the chance. Thanks, Dr. Magdy. Dr. Fatma El-Zanaty is a professor of statistics in the Faculty of Political Science and Statistics. She has over 30 years of expertise in DHS and NHS. She also worked as a consultant to different prominent organizations, including UNICEF, WHO, and the ILO. Dr. Fatma, you have the floor right now. I have less than 13 minutes. I'm a statistician, so my words are measured. I would like to thank Dr. Abla and the ECES and being invited on this to this conference. But we are on the same boat. And we have to understand that anything that's being said or observed, this does not mean that we are placing the blame on the government or the private sector. We're talking with the aim of improving the performance. First of all, I would like to thank the researcher for his outstanding effort, but I was really concerned. I was waiting to listen to a point that was not mentioned. He looked into the service provision, but completely disregarded completely the demand. We have the problem with the demand. it's really good that the unmet demand dropped, but the researchers said that if we wanted to reach for 74% of family planning, and by the way, based on the DHS, we do not have any increase in demand, so we have to bridge the unmet need, but this means that we were not successful to make people properly aware on how to use the contraceptives. This is of significant importance. What does it mean? It means the quality of services, the availability of contraceptives, and a large part of this is tied to the media, how to reach out to women, how to talk to women, and the DHS in 2014 actually pointed out that the information that's given by the media reaches 33%, down from 85%. Also, the communication program also dropped. Why? Because we are in continuous increase on those people who are responsible for the awareness. I mean, how many people can you reach out to? We have the face-to-face communication cannot reach the largest portions of society. And so we have two opportunities here. The first, as you and the social media, because the television now has become obsolete. And we also have an initiative by the Ministry of Solidarity, which is a door-to-door campaign. I believe that it is insufficient to have this campaign was convincing people to only have 2 kids. But they covered those who fell under the Karama and Takeful and all of some of the government rates. So we wanted to think how through different ministries to reach the largest number of people, because Karama Takeful include 2 million households, but it will take you years to reach this number door to door. I mean, the other point to address is quality. Consultation is very important because it determines the most suitable contraceptive. So I know that all of these points are covered in the training, but you have also to keep in mind the monitoring and the follow-up. And the trained personnel also should talk about the side effects. And they should tell people that having side effects does not mean that the whole contraceptive is not working. In one of our visits, we found that one of the doctors was really praised by the women. But these women, when we went to visit the doctor, we found out that that person was not inserting the IUD. He was just a sweet talker. There is another point that should be addressed, data and research. I am saddened by the fact that we have massive research and we find no comprehensive research. All the research that are done in Egypt are now dropping. In 98, I had a very elaborate research. I had a very elaborate research also with the word council on Implanon. We have no idea about the status quo particularly when I have a look at the DHS in 92, the component of the family planning started to decrease for the health component. Because of the concern that's giving to and the attention giving to health. And DHS in 92 included 12 chapters, 6 of which pertain to family planning, birth, knowledge, and the current use, which was a chapter in and of itself. The use of pills and IUD had the whole chapter dedicated to that issue. We need a specialized research on this topic because it is very critical to understand the reasons. Maybe there are preferences for birth preferences, because the whole point was to understand the status quo and understand the demand. I conducted a study in 2011 relying on the data in 2008. Because in the first year, women do not use contraceptives because they want to get pregnant. So I completely eliminated these people, and I thought this woman who did not want to get pregnant and stopped, how high was the birth rate have gotten? It was a really good study. We found that we could have reached 2.7 increase in birth rates. So we have to address these side effects because we have to preserve the right of women to get pregnant. Of course, I have more to say, but unfortunately, my time is up. Thank you, Dr. Fatma.